All right, well, I see this little triangle, and that is appears everywhere. Whenever you start to see any information about eCTD, you see a triangle. Wendy and Adrian, help me out here. Let's figure
Yeah.
out what's inside that triangle.
Yeah, so this is a pretty popular triangle if you've done any research into eCTD at all. And this really shows in a picture the different sections or modules, as we call it, in the eCTD. So it's broken down into 5, and as you see here, it's color-coded based on modules 1, 2, 3, 4, and 5. So starting at the top, there you have your administrative information, your cover letters, your forms, things like that. This is considered your regional information, and it's exactly as it sounds. It's the information that's very specific to the region in which you're submitting, and this is a module that cannot be replicated or cloned in its entirety, at least, because it's very specific. So then moving down into module 2, these are where your summaries reside. And summaries, again, are exactly as they sound. They're going to be the summaries of the rest of the eCTD. So modules 3 through 5 are essentially summarized in module 2 at a higher level. So for example, in 2.5 you have your clinical overview, and then you have your clinical summaries in 2.7. It summarizes module 5, which is listed below it. And again, 2.4, 2.6 summarizes the non-clinical studies in module 4. So moving on to module 3, we have the quality, or CMC, which is chemistry, manufacturing, and controls. Then in module 4, you have your non-clinical or animal studies. And in module 5 is where your clinical and human studies would reside. So this is a very high level picture of the sections. However, each one of these contains numerous subfolders and subsections, all of which data can be included at, and they are organized in the format of an electronic table of contents, if you will. This is your XML backbone. So it's like, as I mentioned, it's really just an electronic table of contents that allows reviewers to easily navigate to these particular sections, because some of them can become very granular depending on which section you're in.
Yeah, and I would like to add here, and these are some of the questions I usually get around the common technical documents. Are there unique differences if you're submitting a biologic, or you're submitting a cancer drug, or a cardiology drug, or a small molecule product? The way the eCTD is structured, there is an entire hierarchy of documents that are standardized in all of the sections that Adrian has illustrated in the eCTD. There's a spot for every single document. So they thought about the forethought of the eCTD really is common across, and there's always a placeholder for every single relevant document. You're going to be able to find a section that's relevant of what you're doing, particularly based on the therapeutic area or the product that you are submitting. So common across all drug types as well.